Ever wondered about those small changes on your skin that could be more than just spots? Well, there's a term you might want to know, BCC. But what is it, and what issues can it really cause? Join me on this journey as we unravel the mysteries of BCC together, the ins and outs, the impact, and what you need to be in the know. Ready for a skin-deep adventure? Let's dive right in. Sue, an energetic sports enthusiast with a passion for playing baseball, encountered a concerning development. She observed red spots on her skin that, over time, transformed into ulcers. Fearing the possibility of skin cancer, Sue took a proactive step and scheduled an appointment with her general practitioner, GP. Upon examination, the GP recommended consulting a dermatologist for a more specialized evaluation. The dermatologist, an expert in skin health, conducted a thorough examination and decided to take a biopsy of the affected area to gather more information. Sue, understandably anxious, awaited the results with a sense of concern. A few days later, she found herself back at the dermatologist's office, where the atmosphere grew heavy as the word cancer was introduced into the conversation. The specialist, understanding Sue's worries, took the time to explain the specific diagnosis: basal cell carcinoma, BCC. Although the term cancer carried weight, the specialist provided Sue with detailed information, clarifying the nature of BCC and potential courses of action. Doctor, what is basal cell carcinoma? Basal cell carcinoma, BCC, is a type of skin cancer that forms in the basal cells of your skin. Basal cells exist in the lower part of your epidermis, which is the outside layer of your skin. Basal cell carcinoma looks like a small, sometimes shiny bump or scaly flat patch on your skin that slowly grows over time. Doctor, what are basal cells? Basal cells are microscopic cells in the outer layer of your skin, epidermis, which is the skin layer that you can see and touch on your body. These cells are responsible for making new skin cells by dividing and copying themselves. When basal cells create new cells, the older skin cells push to the surface of your epidermis, where they die and leave your body. Doctor, what are the types of basal cell carcinoma? There are 4 main types of basal cell carcinoma, BCC, including nodular, superficial spreading, sclerosing, morpheoform, and pigmented. Doctor, who does basal cell carcinoma affect? Basal cell carcinoma, BCC, can affect anyone, but it's slightly more common among men. It occurs more often in people older than 50 years. People with fair skin and light eyes are more likely to get BCC. People who have BCC once are at higher risk for developing another non-melanoma skin cancer in the future. Doctor, how common is basal cell carcinoma? Basal cell carcinoma is the most common type of cancer overall and the most common type of skin cancer. Doctor, what are the signs of basal cell carcinoma? Signs of basal cell carcinoma include lumps, bumps, pimples, scabs or scaly lesions on your skin. The lump may be slightly see-through, translucent, and close to your normal skin color or white to pink, brown to black or black to blue. The lump may appear shinier than the skin around it with tiny visible blood vessels. The lump may grow slowly over time. The lump may be itchy or painful. The lump may form an ulcer, which can ooze clear fluid or bleed with contact. Doctor, where will I find symptoms of basal cell carcinoma? Basal cell carcinomas most commonly appear on areas of your body exposed to the sun. The most common places to have BCC include face, scalp, nose, eyelids, legs, ears, arms. Doctor, what causes basal cell carcinoma? A change to your DNA causes basal cell carcinoma. This change usually happens after your skin has too much exposure to ultraviolet, UV, rays from sunlight or tanning beds. Doctor, how is basal cell carcinoma diagnosed? Depending on the appearance of the skin lesion, your healthcare provider might immediately suspect a basal cell carcinoma diagnosis. To confirm the diagnosis, your provider will complete a physical exam and ask you questions about your symptoms, including, when did the lump or lesion appear on your skin? Did the lesion change in size? Does the lesion look different today from when you first noticed it? Is the lesion painful or itchy? Have you had a skin cancer previously? Doctor, what tests diagnose basal cell carcinoma? After a physical exam, your provider might offer tests to confirm a diagnosis, which could include skin biopsy and imaging tests. Doctor, how is basal cell carcinoma treated? Your provider will treat basal cell carcinoma by removing cancer from your body. To remove cancer, your treatment options could include electrodesiccation and curettage, surgery, cryotherapy or cryosurgery, chemotherapy, photodynamic therapy, PDT, and laser therapy. Doctor, what happens if basal cell carcinoma is left untreated? If you don't receive treatment for basal cell carcinoma, the skin cancer can slowly grow in size and invade deeper tissues like muscle and bone and cartilage. The BCC may become painful and ulcerated, which can cause bleeding and infection. Doctor, what medications treat basal cell carcinoma? Although rare, if your basal cell carcinoma becomes locally advanced or spreads, metastasizes, to another location in your body, doctor, are there side effects of surgical treatment? Any type of surgical removal will leave a scar. There's a low risk of bleeding or infection. Doctor, how can I prevent basal cell carcinoma? While all cases of basal cell carcinoma can't be prevented, you can take steps to reduce your risk by avoiding sun exposure from 10 a.m. to 4 p.m., avoiding tanning beds, and using sunscreen with an SPF of 30 or higher each day, and reapply sunscreen every 2 hours throughout the day if you're outdoors or participating in activities like swimming. As built-in sun protection, UPF, broad-brimmed hats, and sunglasses. Performing a skin self-exam once per month to check for any unusual lumps or lesions. Visiting a dermatologist annually for a skin examination. Contacting your healthcare provider if you have any questions about your skin or changes to your skin. Taking nicotinamide, vitamin B3, 500 milligrams twice a day can reduce the risk of developing new BCC and SCC. Doctor, what can I expect if I have basal cell? The prognosis for people diagnosed with basal cell carcinoma, BCC, is excellent. BCC will rarely spread to other areas of your body and cause harm. There's a low chance that BCC can return after you have it removed. If you notice a new lesion around the scar from previous treatment, visit your healthcare provider immediately. Doctor, when should I see my healthcare provider? It's important to contact a healthcare provider anytime you have a skin problem that doesn't resolve on its own. If you develop any new marks on your skin, if you have a mole that gets larger, or if you experience any symptoms like pain or itchiness associated with the lump or lesion on your skin, contact a provider. Doctor, what is the difference between basal cell carcinoma and other cancers? Basal cell carcinoma, BCC, is a common type of skin cancer that can affect your health. Other types of skin cancer include squamous cell carcinoma, SCC. This is the second most common type of skin cancer after BCC. It's caused by the overproduction of squamous cells in your skin that create cancerous tumors. The most common place for cutaneous SCC to form is on the sun-exposed skin on your head and neck, trunk and extremities. Melanoma. Melanoma is a type of skin cancer that starts in melanocytes, cells, that are responsible for giving your skin pigment. Melanoma is less common than BCC or SCC but may spread quickly throughout your body if not caught early and treated. What is a precancer? Actinic keratosis, AK, isn't a skin cancer. AKs are growths of cells in your epidermis caused by long-term sun exposure. This condition isn't cancerous, it's benign, but it can develop into skin cancer, squamous cell carcinoma. Actinic keratoses are most commonly seen on the sun-exposed skin of your head and neck, including the tops of your ears and lips, as well as your arms and legs. This unexpected journey into the realm of skin health marked a pivotal moment for Sue. The specialist's expertise and explanation helped her navigate the situation with a clearer understanding of her diagnosis and the steps ahead. The story of Sue underscores the importance of prompt medical attention and the reassurance that comes with informed guidance on the path to addressing health concerns. As you reach the conclusion of this video, I want to extend my heartfelt gratitude for accompanying us on this enlightening journey. Your time and attention are deeply appreciated. Remember, knowledge is a powerful tool, and the insights you've gained here can make a lasting impact on your understanding and perspective. If you found value in this content, don't hesitate to hit the like button and consider subscribing. By subscribing, you'll stay connected with our future endeavors, ensuring you never miss out on the opportunity to expand your knowledge. As you continue to explore and learn, remember that every step you take toward education and awareness contributes to your personal growth and empowerment. Thank you for being a part of our community, and we look forward to welcoming you back for more enriching experiences. Until then, stay curious